Here we go. Good morning. I'm pretty sure the audio is going to come in very clear here, and I am very happy this morning to be recording. It is just before 8 a.m. on a Tuesday, late October. Matter of fact, this is the morning following the second longest or tied for the longest World Series game of all time. Happened to be the last one was in Dodger Stadium too, which I think was the Red Sox Dodgers in 2018 Game 3, if I'm not mistaken. That means Mookie Betts has participated in and Clayton Kershaw, two of the longest World Series games in the history of baseball. Just an amazing sport. The umpire was terrible last night. The home plate umpire was god awful. Who knows what would have happened if he had done a better job? We wouldn't have had to struggle through 6 hours of baseball, which I didn't make it past the 11th inning. But I woke up to find out that Freddie Freeman hit another walk-off home run. Kudos to him. Congratulations to the Dodgers. They haven't won the World Series yet, but up 2-1, they're definitely in a good position. I personally think this is going to go 6 games. We'll see what happens. All right, enough of baseball. Usually I'll work out before I record a video, brain-derived neurotrophic factor and endorphins and all the good things that come from feeling good about workouts. But I got to work early today, easy. I got a fresh shave on the dome early. And then there's just, a lot to share. So first I want to start off by saying, if you don't know by now who I am and what I do, I am Dr. Jonathan Pearlman, chiropractor in Richardson, Texas. We serve all of the DFW. I'm very, happy to say that if you needed an adjustment, I hope that I can pat myself on the back and say it'll be worth the drive. We don't do long, drawn-out care plans over here. We do, very necessary sort of pain-based acute chiropractic. Certainly there's a wellness component of it, but I meet my patients where they are. If you come to me seeking a certain thing, I, might be a good fit for you. If you come here seeking a different kind of thing, I might not be the best fit for you. We do everything from Y-axis manual decompression to very, very, very specific precision Gonstead, what I exclusively worked with for about 3 years, but I had to expand my scope of chiropractic technique simply because I have benefited so greatly from Y-axis, ring dinger style adjusting. And it is just so effective for treating people with disc bulge, disc herniation in the lower lumbar spine that even the Gonstead system and people that have been practicing for I don't even know how many years and diplomat status couldn't make me feel any better. And everybody has their excuses as to why that is. I know firsthand that I don't have time for excuses as a patient. When I'm suffering, I'm expecting someone to tell me the truth, deliver on that truth, and really deliver the goods. And it was in the last few years. Obviously I had back surgery that I don't want to say failed, but it certainly didn't, fix the disc problem that I had. And that's a lot of what today's podcast is going to be about. It's going to be about BPC-157 efficacy, BPC-157 healing properties, and application of BPC-157 and how to best use it. And are you getting good BPC-157? And will that help your pain? And what kind of pain? So let's talk about that a little bit more. And then the last thing I was going to say is me and my wife, Jennifer, we are partners. We are lifelong, how should we say, advocates of giving patient-centered care. We love helping people. We devote our life to helping people through education, guidance. My wife is a nurse practitioner. She has prescriptive authority in Texas. We have a supervising physician. Everything is in place here. If you need hormone replacement therapy, if you need women's or men's sexual health, if you need performance-based health options, we are here for you. We can help you. I don't care if it's autoimmune disease. I don't care if it's, your daily, worries about cholesterol or blood sugar. If you're a diabetic and you need someone to work with, if you want GLP-1 weight loss drugs, we provide that service. And we are under the impression, or sort of the moniker, if you will, less is more. What dose of this, that, and the other drug or hormone should I be taking? Most minimal dose to get the maximal effect for your body and all the positive outcomes. So if you're going to a functional medicine person and they're giving you 16 supplements and 4 different peptides, and you're not sure which one you're injecting here, there, and everywhere, and they're coming from all angles, and you gotta take 15 and a half pills a day. Look, to each their own. Like I said, everyone's different. But that is likely a recipe for disaster. But if you have, 2 or 3 peptides that you take throughout the week, and, might be 1 injection a day, maybe, 2 is the maximum, 3 times a week, example, or if you take 3 or 4 supplements throughout the week, then I think you're on a really good regimen and you're doing something right. All right, so let's get into it. I had back surgery at the end of September. So it was that, beginning of September, 9/11, 2023. I had a lumbar decompressive surgery to where they cut out a big portion of my lamina, right? They Dremel, they go right in through. Pretend that this is looking at the bottom of my spine, right? Yoni's skinny butt. And they go in through the canal and they use a Dremel and they make room for the spinal cord to breathe. And they were supposed to do a little bit of a, what they call a intervertebral foraminectomy, so to speak. Foraminotomy would be the right medical term, I believe. And that would be to make room for my nerves to breathe a little. What's interesting is post-MRI, there's really no sign of that. And certainly my legs don't feel like that because I've had some radiculopathy since the surgery finished. That's pinging down the left leg. But, as time went on, it was really, really disheartening as I thought that I was healing, but I just wasn't. And after a lot of setbacks and a lot of aspirin and a lot of acetaminophen and a lot of painkillers, and just painkillers is a misnomer because I didn't use opioids, but really just a lot of NSAIDs, okay? A lot of NSAIDs. And a lot of wasted time going to physical therapy and a lot of wasted time doing a lot of exercises and holds that just made my back spasm. And a lot of you out there I know can relate to that. And then finally I said, I thought I've tried everything before I got surgery, but I actually didn't. I didn't go and get a ring dinger. That's right. I know it's trademarked. I know where it comes from. It's all good. Gregory Johnson, big fan. And so I found the guy in Addison, Dr. Ali, and I went there and, my back was basically out that day. It wasn't, I guess, quite as bad as prior to surgery, but believe me, it was pretty much 10 out of 10. I'm laying up, taking a Medro dose pack, taking those steroids, like, big, right, mainstream medicine. Oh, we got to give more steroids, more steroids, and more steroids. Oh, we got to give gabapentin, more gabapentin, more gabapentin. Oh, we got to give you some injections, more cortisol, more cortisol. Cortisone, sorry. It's just unbelievable because, we forgot the muscle relaxers and okay, we'll break out the opioids. So, this is what they do. So if you're going to a place with like horrible debilitating back pain, you're getting painkillers and muscle relaxers. There it is. I just ruined it for you. That's what you're getting. Is that going to treat the cause? Is that going to go and treat the underlying cause? No, it's just not. Is it masking? The thing is, it's not even treating symptoms. It's masking symptoms. It's dampening symptoms. Just like if you took NSAID and you inhibited prostaglandins, the main driver of the inflammation, and you stopped it dead in its track, yeah, you are reducing inflammation. You're also reducing all the blood flow, not that you would need there initially, by the way. And if you took NSAIDs for an acute situation, you're doing the right thing. So I'm not getting totally like, oh my God, but you take aspirin or I take NSAIDs, just please listen. It's inhibiting, again, masking symptoms, not doing you any benefit in the long term. That's just the whole idea of this. It's not doing you a benefit in the long term. But why does then chiropractic and me giving the credit to the ring dinger and me giving credit to Y-axis traction, why is that actually treating the symptom, right? You heard what I just said. Is it treating the underlying cause? Kind of. Is it 100% treating the underlying symptom rather than masking the symptoms? I know it's nuanced. I know it's my bias when I'm saying this, but you got to understand, it is treating the actual biomechanical issue at hand, aka the underlying cause, via the tribal nucleation, that's the cavitation of the disc. And when it separates and you feel that big whoa and all those reactions you see on YouTube that are very real, that is the disc sort of gapping. It's called a fast stretch reflex. Your hips are pinned in and it takes the pressure off the disc. It's intrathecal pressure built up via a pressure gradient. That's right. Like the bubble in your tire, then you need a new tire, right? Like just really think about it. Or you can go puncture the tire and then put a plug in it and then patch it back up. It's the exact same concept. Now, some people out there will say, no, and show me the evidence and all this. I don't need to show you the evidence when I've had, in the last 2 years, probably about 20 to 25 of those Y-axis manual pulls. And every one of them that does indeed get down that low gives me some relief and allows me to walk straighter and move better. It isn't just because it temporarily masks the pain. I've had adjustments that last, a day or two, and I've had adjustments that last 2 weeks. Yes, you need a dose response. Yes, you need combinations and patterns. Yes, you need continued therapy. Manual therapy is a lifelong management style, whereas the same reason why you take Advil more than once a day for whatever is bothering you. It's the same reason you take your cholesterol medication every day. It's the same reason you take your blood pressure medication every day. When you are managing symptoms, it is a lifelong style no matter what. If you are enhancing performance and on like the opposite end of the spectrum, that's also lifelong management. For anyone out there that thinks that you should get a one and done fix for anything, you don't understand science, you don't understand medicine, you don't understand healthcare. Should you get an obstruction removed via surgery, meaning the limitation of matter has set in and you have a tumor or a lesion or an obstruction, a plaque in an artery, a tumor in your stomach, what happens when you get surgery on those things? That is a one and done if it is a success. If it is a success, that is a one and done kind of thing. Then begins the rehabilitation progress. They don't call it rehab for no reason. They don't tell you to go to rehab therapy or begin occupational therapy or begin physical therapy for no reason. So again, I'm doing all this extra kind of talking here in the middle because it's a point that you need to kind of have ingrained in your head so you can teach your children, their children can teach their children. There is no such thing as like, oh, the chiropractor and I always have to go back. What a quack. There is no such thing as, oh, I have to take my medicine every day. Oh, well, that's just the way it is. Not a quack, but like, that's me and my genetics. No. Look, you can either manage, symptoms due to an underlying disease or an underlying condition for the rest of your life. You can do that also while trying to optimize some stuff every day for the rest of your life. You can try to optimize health without any medicine for the rest of your life. And, you go to the gym, you brush your teeth, you put on your clothes, you shave your head, or you brush your hair, you groom your beard. If you're a lady, you put on a little makeup, you put your hair in a ponytail, you use your products. That's all the exact same thing. The problem is nobody wants to accept the fact that they could possibly have pain. And what's nuts about it, or that they should be out of pain the minute they have it. Oh, it's so unusual. It's right there. And we're all the same when we're hurt. Cortisol's just driven through the roof. Sympathetic nervous system. Oh my God. Do you know how many people come in to me and say, oh my God, it's just like so crazy. I just can't even focus because of the pain, or like the pain is so bad because it's like I just can't stop thinking about it. And then it's like, well, I get adjusted and everything just calms down. Of course. When you are injured, you are in sympathetic tone. When you are injured, you are in fight or flight. Like the breathing is shallow. The tension is high. The teeth are clenched. It's stress. It's a stress response. Just begin to accept it. It's all you have to do. It's okay. Like it's okay that people are hurt like this. And, again, the rehab, the management, the program, it's all the same. It is a lifelong, and I almost said linear, but it's not linear. It's like ebbs and flows, peaks and valleys, down, highs and lows. That's just the way it is. It's how you address it / deal with it, adapt to it, will define your success ultimately in health, in longevity. And before I bring up the BPC-157, I want to talk about, everyone is so hell-bent on the example of an old person breaking their hip. Like, they're old, they might break a hip. It's a disaster. It's the death sentence. It's the classic example. When an old person breaks their hip, it's the beginning of the end. Well, what if a 55-year-old tweaks their back doing a deadlift? What if a 62-year-old goes for a jog in the morning that they've been doing for 25 years, ties their shoe, comes off the couch, and the front of their hip snaps, and their hip is just killing them, and it's never the same. You guys, you know what I'm saying. There are people out there listening to this right now, I hope, that can relate to this. So my point is that this is on a spectrum. There's no such thing as just the devastating hip fracture that is the thing to an elderly person, whatever that age may be. It's the injury that happens each time as we age, where we are less resilient. There is less vascular sort of availability and flow to the tissues, and the inability to repair, so to speak. I should say the ability to optimally repair continues to diminish. The principle of diminishing return that I talk about all the time. What can you do about it? Well, I'm sorry it took 16 minutes to get to this point, but I'm so passionate and I'm so full of energy today. And it's, what can you do about it? Well, there's a reason why they're called longevity clinics. There's a reason why they're called anti-aging. There's a reason why they think about it as like the fountain of youth and all this stuff. It's peptides, it's hormones, it's performance enhancers. You know, are there gray market, black market stuff out there? Yes. Do I promote it? No. Am I saying that there is FDA oversighted compounding sterile pharmacies in good standing where their testing is so rigorous that like you know what it is you're getting, and that's probably why it costs a few dollars more than the gray market stuff? BPC-157 to me in the beginning was like meh, right? I have videos. Go back and look if you want. I have videos of me just like, I told you, I threw the vials away, wasting hundreds of dollars at a time because I didn't think it worked. But when I got compounded sterile pharmacy, real fucking, I mean, this is good BPC-157. And I started injecting sub-Q at the site near my back in my discs. I'm going to tell you right now, I was doing 500 micrograms a day, and I was doing it to the side that had the radiculopathy. But then I started doing 250 on each flank. That's right. So each subcutaneous flank, the side of my body, and the little love handles that I still have on the right and the left side of my body, and the results and the pain relief and the actual carryover of that has been not tenfold, not like 500-fold, but like 10,000-fold for me. And guys, if you know my channel, just look back. I don't have no links to send you to, whatever. I already told you what it is I do. I told you what it is I offer. But this is the real good BPC-157. Okay, so how does it work? Well, you know, there's evidence that it repairs nerves, the damaged nerves. There's evidence that it helps healing in I said osteoblast. It helps healing in bone via osteoblast formation, aka putting down new bone. New tendon, repairing tendon. It is angiogenic, which means it makes new blood vessels. That's sort of like the biggest thing when it comes to BPC-157. The fact that it is making these blood vessels. It is bringing increased blood flow to the site of the injury. That's why it like injecting near the site. They say that systematically it kind of finds it, but I think that the people I respect the most on the internet, everything from intramuscular injection of testosterone to intramuscular injection of the growth hormone, fat-soluble injectables versus like water-soluble injectable like BPC-157, which I do then subcutaneous, again, BPC-157 at the site near the injury, subcutaneous, through the skin, that top level of dermis skin. When I do that near the site, it has been an absolute game changer. I have less leg pain when I wake up. That took a while to get to. Point being, it took about a month. A month of almost every day, so we're going to say 5 days a week, I inject 250 micrograms, that's right, not milligrams, 250 micrograms each side of my back. I'm actually going to upload a video later today of my wife injecting me. Yes, she's a nurse. Not that it matters. When you're at home, you can do whatever you want with your own people. This is not medical advice. I am not your doctor. Again, I'm sorry I'm doing this. I know how sensitive YouTube is, and it's just a real thing. So it's not just in my head. I mean, I doubt my channel's big enough, but you just don't want, this oversight to pick and choose, what they're going to do based off the way you are, using your your voice and the things you say. But again, this angiogenic property, this VEGF as they call it, growth and new blood vessel creation that happens via the BPC-157 anti-inflammatory effects, it's really incredible. And here's the thing. I know there's other people out there saying, well, it causes cancer, it makes tumors grow. First off, there is some data with, mice. There is some other data, I'm sure, with other animals and some studies. There's such limited human studies in general with BPC-157. So a lot of it's just anecdotal or N of 1 or N of 5 or N of 500. That's great. I like those studies better. The methods mean more to me than the results, to be honest with you. The results can be, I want to look at the methods and the age range of the participants in human studies. And when it comes to animals, that's cool. If it's, rehealing, if it's healing consistently ligaments and tendons and then seems to cross over for humans, then that's also really cool, okay? Like that's what it comes down to with some of these studies is very cool. I want to follow the science. So if I see something like, and I'm just going to read off this for a sec, but if I see upregulating growth factor signaling, that's really cool. It doesn't mean it upregulates IGF-1. It's not growth hormone, but if it upregulates or can help growth factor, key to tendon muscle repair, increase nitric oxide, that means bigger, wider vessels into whatever tissue that it's repairing, that's good. You want increased blood flow, not in an acute inflammatory situation where you're just driving pain, but once it's calmed down and you want repair, that's what you want. That's why I was talking about passive to active when it comes to recovery. That's why I just said in the beginning of the video, if you want to take an NSAID early on with an acute injury, do it. Once you start getting into like more of that active phase where you're doing exercise and you're beginning to move and say, oh, I'm getting better, I'm about 50-60% better, BPC-157 would probably be a great intervention. Funny how I had to suffer for a couple of years, my back getting cut open, my muscles, being so weak, and now they're finally strong enough to begin to heal. And, exercise has already been a staple. Like I've already been exercising, but now this BPC-157 is making me a lot less apprehensive, and I'm able to do more things for my core and for my back that I otherwise previous was not able to do. Walking a greater distance, becoming a lot easier. If you've seen my Instagram, I don't know if I put it on YouTube, wearing a weighted vest and walking a greater distance, been a lot better. Anytime that you have a lower sort of body susceptibility to injury and a greater affinity for repair, and you allow something like a BPC-157 peptide to do what it is supposed to do. And I'm usually a guy like everyone, right? We want it now. We want to know that it works now. I did know early on utilizing BPC-157, especially with TB500, but then even starting again with the compounded sterile, we'll just call it the good shit, the good BPC-157, I knew it was working, but I didn't realize how effective it was until honest to God, about 2 weeks ago. And then in the last week, it's been very obvious because I have been pushing myself in the gym to the capacity that typically I would have been hurt again. Have I had my sore days? Yeah. Me and Jen were here at the office yesterday on a Monday. We stayed here 6.5 hours, patching holes, repositioning my bigger TV where I show x-rays. We set up and had to put footing so that the table would not move, the new chiropractic table. We had to fix the sink in the bathroom. We had to patch repair parts out in the waiting area. We were here for a while. We made a trip to Lowe's, we're back and forth. I had to pick up and kind of deadlift, hold, like Arnold Schwarzenegger in Twins while Danny DeVito goes to shut off and get the alarm. I had to do that with like a 250-pound table. That was a lot for my back. A little bit of shock wave, kind of just took it easy, did my BPC-157 when I was home, and I feel really good this morning. Will I go get an adjustment tomorrow or Friday? Yeah, I will. Why? Because I practice what I preach, and I don't allow the pressure that begins to build up within the disc and build up within the IVF and build up within other parts of my spine or other joints. I don't let that go without getting the pressure released or the pressure gradient changed. I don't go without practicing what I preach, knowing that that's been what I call the gateway, chiropractic adjustment, the gateway, that passive big adjustment, that passive therapy that is the cornerstone, the gateway into active therapeutic benefit, utilizing then things like peptides to optimize. And I really hope that makes sense. My best practice of BPC-157, and I know most of the people that will tune into this are looking for that, and then maybe somebody will listen to the video in its full context and say, okay, he says it at 26 minutes and he says it at 15 minutes. BPC-157, 500 micrograms, bilateral, subcutaneous. I don't think that a lot of people know how to assure what they buy from a compounding pharmacy with good BAC water or something sterile to reconstitute is, to get exactly 250 micrograms in the proper needles. It takes a lot of knowledge just to get to that point. Injecting in an inflamed back, even the littlest, easiest needle to use can cause a gigantic pain response. I don't know how many of you have ever gotten dry needling or have been to an acupuncturist or been to acupuncture and had them put needles in your back with your back being achy. I don't know. I don't know about you out there, but again, I've dealt with back pain that is so debilitating for so long. It hurts. It really hurts. Now, does it last 2 seconds? Of course, fucking 0.5 seconds, and then I'm fine, and all I do is But when you're injecting at home and you start to do like what I'm doing and you have a lot of bad back pain, which I'm not telling you to do, I'm simply saying if you did, you could think that you never want to do it again because that initial prick with even the littlest needle, sub-Q, can be so debilitating. It's micro millimeters off of the site you want to inject in, and it is so uncomfortable. And again, I think the point I was trying to make is That's right, because you all came here because you want to know about BPC-157 best practices, and that's just what it is. The way that I just said it, near the injured site sub-Q. But I would definitely say that I'm very happy that BPC-157 has worked for me under the circumstances that it has to this point. But the big takeaway is it's just another component of all the things you should be doing to have these healthy habits, healthy routines, and using everything you can to manage your lifestyle, to manage being healthy, to manage pain. Maybe not the video I intended to make when it first started, but it's the video y'all are going to get when it comes to my BPC-157 experience and healing any joint, best practices. So I'm going to get out of here now, and I'm going to go to the gym. Until next time, this is Dr. Pearlman.